Subscribe to our YouTube channel and press the bell icon to get the latest updates.
Hello everyone, I'm Dr. Sanjeev P. Sahni presenting to you another episode of JIBS Infotainment. Today we would be discussing borderline personality disorder. A mental health condition called borderline personality disorder affects how you think and feel about yourself and other people, making it difficult to function in daily life. Issues with one's self-image, trouble controlling one's emotions and conduct, and a history of rocky relationships are all included. When you have a borderline personality disorder, you may find it difficult to tolerate being alone and have a severe fear of abandonment or instability. Even if you are desired to build enduring and meaningful connections, improper anger, impulsivity, and frequent mood swings may drive people away. The diagnosis of borderline personality disorder has historically been challenging to comprehend and even more challenging to adequately treat. It is accompanied by a terrible medley of emotional turbulence, shaky relationships, and self-destructive conduct, including suicidal thoughts. The prognosis of someone with BPD is now substantially more positive thanks to improved understanding of the condition and new, more effective treatments. Despite the fact that symptoms start to become noticeable in adolescence or even earlier, mental health practitioners were hesitant to diagnose anyone under the age of 18 until recently. Now, doctors emphasize that treatment BPD early improves long-term outcomes and decreases the likelihood of risky or suicidal behavior. People with BPD frequently turn to hazardous options such as substance abuse, causing self-harm, and reckless thrill-seeking because they lack the abilities to deal with difficult emotions more effectively. Self-harm is one of these actions that occurs frequently. Teenagers often employ actions like cutting, itching, and opening wounds to get rid of uncomfortable emotions or find a way of dealing with their perplexed state of mind. It may actually function as an emotional management method. If it helps first time, they are more inclined to use it again to deal with unpleasant emotions, which is the problem. We must recognize the benefits of self-harm and work to provide them with safer alternatives in order to reduce it. One hazardous misconception regarding BPD is that the self-destructive behaviors such as suicide attempts and emotional drama are attention-seeking tricks. Hence, we end up ignoring all the signs and symptoms associated with BPD. What are the various symptoms of BPD? Frantic attempts to prevent abandonment, whether it be real or imagined. An escalating trend or strained and insecure relationships. Negative self-perception. Suicidal gestures, threats, or self-mutilation. High sensitivity and emotional instability. Feeling of emptiness. Worry that is excessive, unwarranted, or difficult to manage. Last is paranoid triggered by stress. If BPD is viewed as an inability to regulate one's emotions, it is essential to get someone who exhibits symptoms into treatment as soon as possible before it becomes their pattern of behavior and affects their daily life functioning, also jeopardize their relations with others. This is especially crucial for young people because BPD symptoms make it challenging for them to build their identities and sense of self. Without prompt diagnosis, individuals struggle with self-understanding and self-identity confusion. They have social anxiety as a result, which makes it challenging for them to handle their unresolved tensions and social relations. There are specific psychotherapies that have been created to treat BPD, but dialectical behavioral therapy, which is called DBT, is the gold standard therapy, the one with the greatest evidence for its efficacy. The need for acceptance and the need for change are two elements that can appear to be at odds but are yet essential, which is why it is called dialectical. Schema-focused treatment can be carried out in a group or one-on-one setting. It can assist you in identifying unmet needs that have given rise to unhealthy life habits that, though they may have been necessary for survival at one point, are now detrimental in many aspects of your life as an adult. Symptoms or co-occurring issues like sadness, impulsivity, anger, or anxiety may also be helped by specific drugs. That's it in this video. Keep watching JIBS Infotainment for more informative content. Don't forget to like, share, and subscribe to our channel. Thank you.